Hello AlphaFlo, this is Kelly Calabrese, and today I'm here with Dr. Jennifer Devine from Rose Rock Veterinary Hospital and Pet Resort. Jennifer, thanks so much for being with us.
Thank you.
Yeah, so Dr. Jennifer, tell us a little bit about what goes on here at Rose Rock.
So we are a very diverse practice. We strive at being kind of elite and having top-notch medicine availability for all of our clients. So a lot of things we do here, we do general practice. We also have specifically a secondary practice of rehab and alternative therapy medicine to be able to help those pets that are either geriatric, recovering from post-operative orthopedic procedures, or even those who can't afford orthopedic procedures, making sure that we can offer them quality pain control. We also do some palliative care medicine, specifically for pain management and senior dogs that may have cancer or conditions that cannot be treated in other manners. So in regards to what we do here, we do general practice, your routine vaccinations, ear infections, things like that. We also offer some state-of-the-art diagnostics in regards to endoscopy, CT, ultrasound. So we're very diverse here in making sure that our patients have the best quality of care.
It is very comprehensive and very, very impressive. So congratulations.
Thank you.
And thank you so much for
It's
bringing
taken
this
years
model.
to build it.
Yes, we love that. So tell us, how did you first hear about AlphaFlo?
So I heard about AlphaFlo originally from Dr. Jody Lamb. She sent me an email saying, hey, if you have a chance to come down for this CE, we'd be more than happy to talk to you about it. It's very similar to platelet-rich plasma, which she knows that I do routinely because they've actually referred to me for it. And I told her, I said, that sounds great. Didn't actually end up making the meeting. Thank you, Stomach Bug from daycare for the kids. But then reached out to one of my equine friends, Dr. White, who works in Purcell, and kind of asked her a little bit about it. And she's like, girl, you got to look into this. Like, it's an amazing product. She started telling me equine cases that, I mean, just the stories and the case studies she was telling me were just fabulous. And I was like, well, that sounds amazing. Like, we've been using PRP, stem cell, the Renovo, and equine for years. She's been seeing great results. And I was like, okay, well, let's contact and see what we can do. And contacted Ginger, and you had it here within 48 hours. So, but it's been within that 48 hours, we already had like 8 clients lined up who were interested in the product. Those that had been long-term rehab clients with me and patients, and we had seen for some of them their condition had become very static. There was no change. They were maintained and they were essentially pain-free, but we were still experiencing some lameness. So we kind of discussed it with the clients and said, hey, we have this new product. Half of those clients had actually had platelet-rich plasma in the past, and we were starting to see that wear off. So we were like, well, let's try a different product, and overnight results with a lot of them. It's been absolutely phenomenal.
Wow, well, we love to hear that. About how many cases have you used it in so far?
Oh my gosh, I have a stack of papers I need to send with you. 8 to 10.
Okay.
So one of them we use routinely. He is a bone cancer patient. He was diagnosed, we originally thought was with arthritis about a year ago. Then we started seeing a lesion in his bone actually progressively get worse. Got a second opinion by a radiologist. Went through a battery of tests. We haven't been able to solidify what type of bone cancer, and mom doesn't want to do like extreme surgery or anything like that. So we've set him up on a palliative care regimen, which actually involves AlphaFlo. So we're trying to address his arthritic pain along with his bone cancer pain, and we're using AlphaFlo in a mix with a chemotherapy drug to do so, and starting to wean him off some of his pain medications, which is phenomenal. Because most of the time with bone cancer, you cannot wean them off of pain meds.
That is phenomenal. Is there another case you can share with us?
So my other favorite one is Miss Gracie. She has been a long-term rehab client with me, 4 to 6 years. So we started off originally in her younger years. She blew out her knee, ended up having to go for a TPLO. After having a TPLO, blew out her meniscus 2 months later, ended up having to go back for a meniscectomy. And then just over the years, just kind of wear and tear on the body. She is a go-getting lab. She loves life, loves to chase, loves to fence run. Over the years, we've seen progressive arthritis in her elbows, really significant arthritis in her spine. She's been doing 1 to 2 weekly rehab with us for about 2 years straight in her senior life. So I approached mom, we'd reached kind of a standstill in her progress. She was still having some limping, still having to be on oral pain medications, along with keeping her strong with rehab, and we were doing acupuncture, laser, the whole shebang. Did injection in each elbow, injection in each knee, and then we did 24 injections along her spine, and within 3 to 4 days she was completely sound, so lameness free, which was phenomenal. Mom and dad were absolutely thrilled.
Wow, we
So
love that.
great results. I also had another one recently, had an MRI at Blue Pearl. intervertebral disc disease in the neck. She came, the dog refused, it was a little Yorkie, refused to lift the neck or move it, did an AlphaFlo injection. Within 48 hours, she was willing to move her neck up and down. So very comfortable. So phenomenal results. And the nice thing is it's nice to be able to offer an alternative that doesn't involve oral medications, because even though I'm not 100% holistic, I do believe in trying to avoid chronic medication usage just because of side effects that can occur with non-steroidals and control drugs later in life. So whatever we can do to maintain them before having to go into the drug cabinet to do, pain medications is what I look for my patients.
Wow, that is a great point. We love that. We love the holistic approach. You use insurance in your practice, and it's something that you encourage with your patients. Can you tell us about how that's working with AlphaFlo?
So we love recommending insurance. I recommend insurance for every dog out there. Even my nurses, my front desk staff, they have insurance on their animals. AlphaFlo, in regards to working with some of the insurance companies, it's still becoming progressive, getting all insurance companies on board, but the ones we have worked with have been very receptive to it. It's one of those things, when we have an insured animal, you're able to do those things that you may have not been able to do for that pet prior. So getting your pet on insurance at an early age, always making sure, looking at your insurance company, I always recommend making sure that they're over at least 5 years of age in the sense of being an established insurance company, and then asking them, do they have a specific additional rider that you have to add on for alternative medicine and rehab? Because unfortunately, a lot of these injections are classified under those additional riders for some insurance companies. Now, some will include it as part of the whole program depending on the level of package, but making sure you talk to your insurance company to where they're going to cover arthritis injections, possible chiropractic care, rehab, because most people don't think that as their animals get older, we just say, oh, he's slowing down because he's 12. No, he's slowing down because he hurts. So being able to offer them that care that you would want as a senior, and being able to have, comprehensive PT, looking at acupuncture, laser therapy, looking at joint injections to try and prevent orthopedic surgeries down the line is substantial. And we've had, wonderful results in regards to our patients who have been insured. The insurance companies will submit a pre-approval just to make sure they're going to cover it. We get a positive, yes from the pre-approval company, and the animals are just doing so much better.
That makes so much sense. Thanks for sharing that and explaining that. So our sister company, Renova, which is our equine product, has been out for a while. It's been used in over 12,000 horses approximately, but AlphaFlo is a newer product. So what would you say to some of the small animal vets who have not yet tried AlphaFlo?
Highly recommend bringing it into your practice. If you don't feel comfortable bringing it into your practice, you're more than welcome to refer them to me to do it. We do work on a referral basis here within our rehab, so we do have a lot of referrals where we have primary physicians, and then we offer that specialized secondary care. But it is a phenomenal product that I recommend considering if you feel comfortable doing joint injections and spinal injections, because it has had fabulous results.
Well, thank you, Dr. Jennifer. We really appreciate you.
Thank you so much.